same 3 tests that we did for range of motion today. So we're going to do abduction, so we're going to do internal rotation and external rotation. And if you noticed on your videos in Moodle, we're not going to test you on adduction. And that's in range of motion and strength-wise, not our most pressing needed, and I don't really see too many people that are stuck out there unless they have a medullary latch syndrome at the gym. So most people can get down here, or if they have soft tissue approximation, and in that case we're not going to make any change in that. And then horizontal ab and adduction, not necessarily motions that we measure strength or range of motion for very regularly. So just view the video, realize that you can measure them and know basically where to put your implement, but those aren't going to be the most pressing. So we're going to focus in on flexion, extension, abduction, abduction, and internal external rotation with your skill check and with your lab exam. And then just realize that scaption is just a slight variation of abduction. So that won't true scaption won't be on your skill check or your exam. Okay, just know the difference. Scaption is slightly forward. All right, so you've had a little break to think and go back and review if need be. Who's going to be our first volunteer to manual muscle test shoulder A-B abduction?
This is easy when we practice it last.
I know, we did flexion and we kind of talked a little bit about abduction.
I'll try.
All right. Way to go.
Come on over.
I applaud that. The next contestant on The Price is Right.
Or Ron.
Or Ron. Continue.
So this test is done in sitting.
Mm-hmm.
And
Boom, done with that.
what we're going to be doing is you're going to abduct your arm.
Okay, good call. Edge of the table is best. So you don't have to lean onto the table.
So you can hold it against gravity, which tells me he's a 3, which means I can go ahead and relax a second. And then I can do the tougher test. So he'll place his arm out here, I'll apply pressure right here. It's the muscle test testing your abductors on your shoulder. When I give pressure, just resist my pressure, okay?
Yeah, remember with your right hand, you should try to stabilize and palpate. There you go. And he is correct. The palm should be facing downward, and force is applied proximal to the elbow. Correct?
Yep. Good position.
All right, ready?
I see some good body mechanics now.
Yeah, maybe I'll lower the table a little bit.
There you go. Yeah. And scooting to the edge there will give you a little bit more room as well.
It's freaky when it moves when you're on the very edge.
You're living on the edge.
All right, on the count of 3, resist my pressure, okay?
Okay.
Ready? 1, 2, and 3. Hold it, hold it, hold it, and relax. He was able to resist maximal pressure, so he's a 5 out of 5.
All right. Sounds good. Comments? Feedback?
What about substitutions?
Yes, I like that question.
So maybe, I don't want to see leaning towards the opposite side.
Good? Yeah.
Holding with the other hand on that table.
Very good one.
Oh, no.
Elevate
Don't use
your
your traps. Use it.
Yes.
Right, this one.
Going back to.
Yes, yes.
Would he rotate his arm?
I'd say less common,
Good.
but certainly possible. We don't have a lot of power in our rotator necessarily.
Well, you could rotate it to try and use your upper pecs.
You'd have to go through a pretty dramatic arc of rotation to get that, but
Yeah, not common, but
Upper trap.
definitely you can tell your patients
Trunk
keep your arm in
flexion.
this position,
side
keep
back
your
rotation.
Oh, yeah.
trunk in this
Good
position.
posture.
Yeah, absolutely. Absolutely. Yeah.
And should the palm be up or down?